Okay, so let me show you our first patient this morning. This lady had a tummy tuck and fat transfer to breast. So this was our patient 3 months ago. As you can see, she's got a lot of loose skin belly that's bulging out and sort of some droopier, deflated breasts. This was her belly before surgery. Now, some people might think she must be really overweight, high BMI. She wasn't. She was one of those patients that had really stretched out abdominal muscles and her abdominal contents was kind of just falling out, so they're just bulging out. So we did a tummy tuck on her, and to go from here to there, this was muscle tightening. We did some liposuction, but remember, we're not sucking out internal abdominal contents or removing intra-abdominal contents. We simply tighten the muscle. So not everybody who looks like this is a candidate for surgery. You must have loose abdominal muscles and your belly must be soft. So when you lie down on your back, all of this falls in. And when you stand, things fall out and your belly's bulging out. But again, to go from here to here is only possible if you have a low BMI and just loose muscles. So very important point. This is pretty simple, no-brainer, but sometimes people don't realize it. If you have a lot of intra-abdominal volume, internal fat, no matter how hard you push on your belly, there's opposing force pushing out. So try this on yourself. Push into your belly and feel how much force you need to push it in. If it's a lot of pressure, that means there's a lot of pressure pushing against you, pushing out. So if I was to go in and do a muscle repair, tighten everything, push things down, 24/7, there's an opposing force pushing out, and over time, the muscles will stretch out again and your belly is going to bulge out. And this is why it's important to lose weight, intra-abdominal fat, before your tummy tuck. Tummy tuck is not a weight loss surgery. This is why we sometimes turn people away. They don't understand why. Because when we examine, we find they have a lot of intra-abdominal fat and there's no amount of tummy tuck and muscle tightening that's going to fix that. You need to lose the weight on your own. Simple thing to remember, not everybody can get the same results, same impressive results. Even though two people may look exactly the same on the outside, the internal makeup, internal structure may be different and they will get different results, or some may get turned away. So I showed you a patient who had what looked like really big bulging belly and had tummy tuck, and what a beautiful result she had as a result of her muscle tightening. Let me show you another patient who had a similar thing done. She had a bulging belly, she had stretched out muscles post-pregnancy, and we did muscle tightening. But this patient, unlike the previous patient, didn't only have muscle separation, but still had some intra-abdominal volume. So we tightened her muscles, but we cannot take away the intra-abdominal volume. So this patient, as you can see, she looks like she's a very skinny lady. Just, you can see her core right there and her belly's bulging out. You can see she's really pushed out. So she has a belly button hernia during pregnancy. This really got stretched out, muscles got separated, belly's bulging out. So we went ahead and did a tummy tuck for her and a muscle tightening. And here she is before surgery, here she is shortly after. You can see that bulge is gone. It's still a little bit there, but it's much less. We've tightened up the muscles. But again, despite my best efforts, there's only so much I can tighten up. I can't squeeze in more than possible because she had intra-abdominal volume. So that's the limitation. Not everybody can get a perfectly flat belly. Since the surgery, she says she feels like her belly is bulging out a little bit more. And if you take a look, this was her shortly after surgery, this is her today. You can see it's bulging out a little bit more. I tightened up her muscles. This was shortly after. Over time, the muscles stretch out again. No matter how much I tighten the muscles, if there's a lot of internal volume that's always going to be pushing out, over time the body will stretch out, and this is where we are now. Now this is better than she was before surgery, but it's not as tight as it was right after. So this was the before and after. Improvement limited by intra-abdominal fat. Our next patient is a lady who is here after 2 C-sections, 2 pregnancies, and now has muscle separation and her belly is bulging out. And so here's our next patient. You can see she's got a little belly button hernia. She's got some skin hanging out, but you see she's really bulging. Her muscle separation is really wide, and the belly is really protruding. And as I was explaining to this patient, you can see the belly is bulging out. When I give her a pinch, you guys know my pinch thickness. This is her external skin and fat. That's not a lot. Most of this volume that you see here is intra-abdominal. So if I was to do a muscle repair here, muscle repair is going to push against your belly, but you can't really see it in the video, but after a point there's a lot of force that I'm pushing here. So when I'm pushing with the muscles down, there's the opposing force pushing out, and this is force that's there 24/7. So we ask our patients to lose some weight, so this outward pushing force is minimal. We take it away, and then the muscle repair and the muscle flattening and tummy tightening becomes more permanent, because if there's a lot of force outgoing, over time it'll just stretch out and your belly is going to bulge out again. And I want to stress this, it's really, really important, because sometimes we get patients contacting us saying, hey, but I've seen Dr. Hugenberg work on patients who look like me who are larger. No, we have our BMI cutoff. And when we see you, we examine you to see whether your fat is external, if you have loose muscles, or if you have a lot of internal abdominal fat. If you have a lot of intra-abdominal fat, you're not a candidate for surgery. So a patient who may look exactly the same as this patient on the outside may have a different internal composition, and I can't give you the same results unless you're twins.